If you're a parent of a pitcher, you've probably been told to watch pitch counts or ice the arm, but here's what really matters. Is your son strong enough to handle the demands of pitching? Most throwing injuries happen because of missed weaknesses. Today, I'll show you the key strength tests I use with baseball players and how they help prevent injury, keep performance up, and keep kids on the field. I'm Dr. Dominic Rangel, and I'm a physical therapist and a baseball arm care specialist. And these are the tests that can make the difference in your son's season. Welcome back to the Mound Ready podcast, the show where baseball players, parents, and coaches learn how to protect their arms, build real strength, and get back to dominating on the field. I'm your host, Dr. Dominic Rangel. Let's jump into today's episode and get you one step closer to being Mound Ready. What's up, everybody, and welcome back. I am so excited to talk about this topic today. But first, let's talk about some key items. If you're following along on Instagram, then hit the subscribe button if you like what you're hearing. And if you're listening in on our audio podcast, then make sure you follow me to get all the baseball info I'm putting out over the next few weeks. We're taking a small little shift and we're focusing on the parent of the youth athlete, but we'll keep on keeping on with some of the information that we're passing out. If there's anything that you want me to talk about in the upcoming podcast, then feel free to comment and let me know. Also, I'm going to be talking about a handheld dynamometer in this episode, so I will put a link to the website of the monitor I use, which is available for purchase through a different website. Highly recommend that all baseball players have one, and this episode will explain why. You can also use the code RPT. That's the letters RPT for a 10% discount. But enough of that. Let's go ahead and jump into the topic. So the first thing that I want to talk about is why does strength matter more than you actually think? So let's go ahead and get this out of the way first. Throwing a baseball, especially pitching, is one of the most violent movements in all of sports. You're producing thousands of degrees per second of rotation, generating elite level forces over and over again. I know what you're thinking. And yes, this means little kids too. Youth athletes are still generating tons of force that's running through their arm. So if your muscles aren't ready, that load doesn't just disappear. The muscles don't just tolerate it and then it goes away. It gets shifted onto other structures that can't contract. Things like your ligaments or your bones. This is where we start talking about things like UCL tears, rotator cuff tears. That is a muscle. But even growth plate injuries in youth athletes. The two most common that I see are definitely they got to be little leaguer's elbow and little leaguer's shoulder. I literally see at least one a week. Like I said, if your muscles aren't strong enough to handle the load goes somewhere else. And here's the thing. Most programs never even test if you're strong enough. They stretch you, they band you, and they hope that you're okay. But hope isn't really a rehab strategy. You know that? I know that, and I don't have to tell you that. So for whenever we're going through these testings, the objective strength metrics that actually matter are the things that we're going to talk about next. Here are the things that I test in nearly every pitcher I work with. Not nearly, literally every pitcher I work with. I'm going to focus on the upper half in this section of the podcast. The first and foremost, I got to use a handheld dynamometer, right? The handheld dynamometer itself is going to measure true force output of the rotator cuff. We can utilize foot to pounds. We can utilize Newton meters. It doesn't matter as long as you're tracking that metric and measuring correctly. We're going to measure the testing for rotator cuffs, scapular stabilizers, and the grip. I'll come back to that here in a second. The big thing with using a handheld dynamometer versus testing the way that most people do. When most providers are getting athletes, what they're doing is they're doing something called a manual muscle test. For those that don't know, the manual muscle test is basically when the provider says, hold your arms in this one place. I'm going to push it. Don't let me move it. They hold your arms in that one place. And as they're trying to push, they're going to basically say, okay, your strength is insert the number. It can be anything from a 0 to a 5 out of 5, right? And so 5 out of 5 is they can't move your arms and they can't move your legs, whatever it is they're testing. And then it slowly cascades down to 0. For 0, you got to think like a spinal cord injury where that actually doesn't move at all. There's 0% muscle activation. The big thing that we do know now about manual muscle testing is that even though you test at the highest, which is the 5 out of 5, then you can still have around a 10 to 15% difference in the strength when you compare arm to arm. And honestly, for baseball players, I'm looking for way more than even if it's 15% difference, that's a what, 85% limb symmetry. I'm actually looking for a lot of those muscles to be over 100% because I want the throwing arm to be stronger than the non-throwing arm, right? So we're going to look for both peak force and side-to-side symmetry. So how much total force do you output? And we compare that with body weight. And then we're also going to compare side-to-side symmetry. That's called LSI, or limb symmetry index. The most important directions that I'm going to test are going to be scaption, external rotation, internal rotation, and 2-finger pinch grip. So next, whenever I have these numbers for external and internal rotation, I'm going to convert them into something called torque to body weight ratio. This is very, very specific and very, very important, especially for any patient that is post-op. I highly recommend that if you're a provider and you're listening to this, you absolutely start to track torque to body weight, and you absolutely start to use a handheld dynamometer. If you're a parent, push for the provider to also utilize some of these measures. And if they don't know, then either tell them that that's something that you want done, or tell them that you're going to go somewhere else because this is something that you want to have done for your child. So the big questions that it's going to answer are going to be, can your arm generate and control enough torque for your size? So the main reason that I like to convert these measurements into torque to body weight is because this is going to account for how much does the athlete weigh, because we know not all athletes weigh the same. Some are bigger, some are smaller, some are really small, right? And then it's also going to include the length of their forearm, because based on physics, we know longer arms can generate more torque. Shorter arms generate less torque. So basically the length of the arm is also going to be a factor in how much torque you can produce in order to keep your arm safe. We also have norms that we use to match and meet as for criteria for whenever somebody is ready to progress back to plyometrics, returning to throw, and then also integrating back into sport. But what do we know about grip strength? So there's a really strong correlation to forearm durability, elbow stability, and shoulder health when we're testing grip strength. It focuses on the test that we do is going to focus on the main muscles. So we do a 2-finger pinch grip test because that is going to maximize the muscle, or it's going to test the muscle that we utilize in pitching more specifically than if we just do a full hand grip test. And that's going to transfer over much better to a baseball player as opposed to the general population. The last thing that we're going to talk about here is going to be rotator cuff endurance. So being strong for 1 rep means absolutely nothing if you break down by pitch 30. We test how well you can maintain force under fatigue. We might do something like a 90-90 wall tap test, where we compare how many times can you tap the wall in that 90-90 position using your throwing arm versus your non-throwing arm. Or we're going to do something like a prone tee ball drop test and compare like how many times can you let your arm hang off a table and drop a ball and catch it over and over and over again in 30 seconds, and compare right to left and see which one has more endurance. So those are that's not all of the tests that we do, but that is a lot of the tests that we do. There's a whole list of things that I like to take people through. But with all that said, I just want you to think of it like this way. So like, you wouldn't drive a car with no brakes, right? So you shouldn't throw with a shoulder that can't decelerate at game speed, because ultimately it's going to lead to some type of breakdown, right? In a car, you're running into a wall or another car. In the baseball player and the pitcher, you're going to end up with some type of injury because you're not tracking the things that you need to track to keep yourself safe. I really, really want to talk about some injury predictors that a lot of coaches are missing. And if you're a parent or you're a coach, this is going to be very important for you to listen to, because you're going to be the ones that are going to need to check in on these things, right? So also, strength coaches is going to be a big one for this. What we've been seeing is if a pitcher can't bench at around 80% of their body weight, so this is probably more towards that group that's a little bit older, that has already started lifting in the weight room, and we're able to track some of these metrics. We have to keep in mind that there is a mean age of how long has somebody been working out? If somebody has never worked out or doesn't really lift weights, then this is not something that we're going to be looking at, because they don't even know, or I'm not going to have them test it if they've never done it before. But coming on back, we're going to say If the pitcher can't bench at least 80% of their body weight for 3 reps, there's a much higher likelihood that they're going to compensate and they're going to utilize forearm muscles more because the pecs cannot decelerate the arm coming back into horizontal abduction towards that layback position, and that's going to put the UCL at risk. Another one that we're constantly missing is leg strength. I mean, I kept hinting at that. I'm going to hint at that a lot along the way throughout the whole podcast and all the future episodes. Poor quad strength in the lead leg means you cannot block effectively. If you can't block, your trunk is going to open early. You're going to have more rotational speed, and you're going to have more arm stress. So that's huge. Like something as simple as working out your legs can reduce the stress that you feel on your arm. If you're a parent and your child is not getting into strength and conditioning or not doing any type, then this is like the low-hanging fruit. Find a place that can safely progress them through a strength and conditioning program because it's gonna help reduce the stress on their arm. The big thing is if you can have a strong arm, but if your legs are soft, your arm is still gonna take the hit. Moving into the next topic, strength isn't just about force. Yes, of course, when we talk about strength, we're talking about producing force, but it's also about protection. You have to factor in both, right? So let's frame what strength actually gives you. So when you're stronger, you're going to have less relative effort per throw. So every time you throw, your muscles have to do less work because they're able to produce more force. So if 100% of my force is normally 100 newtons and pitching is 70 newtons, then I'm going to be using 70% of my force with every pitch. But now let's say I can actually produce like 140 newtons of force. And now all of a sudden, I'm only utilizing 50% of the total capacity of the muscle. In the long run, I'm utilizing less strength per throw. So that means I can last longer in the game. If you have more strength, you're going to have better deceleration. So you can stop the arm and not just accelerate it. We already gave an analogy for that using the car that has terrible brakes. So more strength equals longer durability. Fatigue sets in later in the games and your mechanics can stay cleaner longer. So you're going to look better as you go through the game. You're going to be able to stay in and pitch more, and you're going to be ready to continue to throw if your team needs you. It's not about how much you bench or deadlift for Instagram. It's about building a durable system that can handle the workload of a whole season. Stop training for the gram. Stop allowing your child to train for the gram and start training for the health or for your health and for their health and for their career. Strength doesn't just help you perform, it helps you recover and it helps you last in the long run. So how do we incorporate strength testing into programs? Well, that's a big question. So how do you actually build it in and when do you find time? Well, here's the big things that I recommend. One, you got to have some type of baseline testing at the start of each season. You got to have some baseline testing at the start of the off season. And you got to make sure that you're tracking things throughout the entire season every so often. So the first thing is the handheld dynamometry testing that we were talking about. Got to test the rotator cuff, got to test scapular strength, and you got to test your grip. We're going to utilize body weight ratios. We're going to utilize torque to body weight, and we're going to utilize strength velocity ratios where we utilize your last known max velocity and compute that into another ratio. We got to do some plyometric assessments if it's needed and if it's warranted, if the athlete can do it. And then we also got to retest every 4 to 6 weeks, just like I was saying. We got to know, are the numbers improving? Are you fatigued? Do you have poor recovery? And if the numbers are not where they need to be, and your training isn't working, then maybe you're not ready to progress. Maybe we got to slow it down, or maybe we got to speed you up. It just kind of depends, right? We got to keep tracking these things because they're always going to be changing. They're ever changing all the time. The last thing is we have to match your strength to throwing volume. So if your throwing program is increasing in the amount of throws that you're doing, that's going to have higher strength demands. You're going to utilize more strength. Yes, it's not a lot more. It's not like you're lifting at 1% or 100% of your 1 rep max each time that you're throwing. But in the long run, just like we were saying, each time you throw, there's a certain amount of force that goes through your arm. So I have to factor that in whenever I'm giving you exercises outside of that. Maybe you have a heavy set throwing day. Maybe on that day, I'm not going to give you a ton of arm care exercises. Maybe you have a day where it's supposed to be your off day. I'm also probably not going to give you a ton of rehab exercises or arm care exercises on that day. It just waxes and wanes based on how you're doing and what your program looks like. The big thing that I'm trying to get across is that rehab and strength work needs to scale with your workload. We don't just build strength to pass a test. We build strength to meet the demands of throwing. Because ultimately, what we want is for you and your child, you or your child, to be able to throw for the long term. Maybe they're like 8, and okay, let's say they're 8. They don't need to be, the all-star right now, but you still want to make sure that whenever they get to that like 8 to 13 or like 15-year-old phase of time, they're going to grow at an exponential rate. And that is actually the time whenever little leaguer's elbow and shoulder is most prominent. So these things that I'm talking about are going to help your child keep themselves from potentially leading into some type of injury and some type of pain. Now, you can't prevent every injury, but you can stop a lot of them by testing the right things and training for what matters. If no one's tested your child's strength with a dynamometer, if you've never measured torque to body weight or grip strength, and if your plan is just bands for arm strength, you probably need a better plan. You can text me. You can text me at 210-390-6577, and I'll help you figure out where the gaps are and how you can close them. Let's get your child mound ready the right way.